impact has been especially hard on regional and rural hospitals where there are no critical care beds left, he said. There's no critical care beds left. So that means that patients are going to be having a really difficult time. Yeah, what up? It's your boy Rob, coming back at you once again with another video. So before we get started, you already know what to do. If you're not subscribed to the channel, make sure you hit the bell icon twice. Smash the like button, share this video out to all of your followers, and let's get into it. So today's article comes from the Seattle Times, and we are talking about the Delta variant of COVID-19. If anybody is not familiar with the Delta variant of COVID-19, the Delta variant of COVID-19 is the most recent variant of concern as designated by the CDC and WHO. What that means is that it's a highly infectious variant that can cause some issues with vaccination. This is one of the reasons why the United States federal government has recommended an additional booster shot for the Pfizer and Moderna vaccines. All right. So again, this story takes place in Washington, and let's get into it. All right. Driven by Delta, COVID cases in Washington continue to rise, especially among the unvaccinated. The number of hospitalized COVID-19 patients in Washington is doubling every 18 to 19 days. That's a lot. That is a lot. State health officials said at a Department of Health briefing Wednesday morning. The surge, driven by the Delta variant, has stressed, stretched, and strained hospital resources across the state, Secretary of Health Dr. Umair Shah said. DOH has documented 5,879 possible vaccine breakthrough cases. Now, my question for anybody that's watching this video is, are you familiar with what a vaccine breakthrough case is? If you are, please type it in the comments. If you are not, you need to watch enough videos until you do know, because it's very important. It's one of the reasons why they are recommending an additional booster, okay? But the vast majority of cases involve unvaccinated patients, all right? So we're going to highlight this. The vast majority of cases involve unvaccinated patients. More than 94% of COVID-19 patients hospitalized between February 1st and August 3rd were not fully vaccinated, Shah said, which is interesting because now that the government is recommending a third, that would mean that everybody who got vaccinated before, if they have not gotten the recommended booster, then I guess they wouldn't be fully vaccinated now, would they? How are they doing that? How are they categorizing that? And for the YouTube people that like to censor, block, or take things down, all I'm doing is asking a question because I wasn't able to find it in my research. So I'm asking my listeners to see if they know. All right. So we got a couple tweets from the Washington Department of Health. A rise in cases is overwhelming hospitals. Hospitals throughout the state are facing their highest levels of occupancy ever while struggling with national shortages of workers. According to Dr. Steve Mitchell, medical director for emergency services at Harborview Medical Center, the impact has been especially hard on regional and rural hospitals where there are no critical care beds left, he said. There's no critical care beds left. So that means that patients are going to be having a really difficult time. Oh, man. That's had an impact on mortality as hospitals have spent critical care time trying to find scarce beds, Mitchell said. Youth have been impacted as well as adults, which could be of concern as the school year begins. According to the Department of Health, a young person died of COVID-19 at a Seattle area hospital on Tuesday. The death was confirmed by the state's chief science officer, Mr. Scott Lindquist, during the media briefing on Wednesday. Lindquist did not share additional information on the patient other than to say they were between 0 and 19. Well, that's interesting, Dr. Lindquist. I've never met anybody that's 0 years old. And the death was very disappointing. Most death is. Oh, Well, this one was only disappointing because we have masks and vaccines available. Oh, so I spoke too soon. Ladies and gentlemen, the Delta variant continues to rage wild throughout the entire United States. Learn these things, pay attention to them, pay attention to what is being recommended, pay attention to what you can and cannot do. Make sure you keep yourself healthy, hydrated, and use proper hygiene, everyone. Because God knows some of us don't. People like to tweet about what they do and don't wash every damn day. So with that being said, ladies and gentlemen, that's the end of the video. I hope you enjoyed it. If you're not subscribed to this channel, make sure you hit the bell icon twice, smash the like button, share this video out to all of your followers, and I will catch you on the next video. All right? Peace.